Hi, my name is Andrew Keller. I'm a radiation oncology resident at UPMC Hillman Cancer Center. I just wanted to give an overview of our weekly web-based radiation oncology educational conference across our large integrated cancer network. These are our disclosures. Following completion of residency, self-directed learning is needed to ensure practicing radiation oncologists remain up to date on clinically relevant literature and changes in the field which can directly impact patient care. We created a weekly web-based radiation oncology educational conference, known as eRounds, to help facilitate learning across our large integrated cancer network with over 25 national and international radiation oncology centers. We arranged for residents and attending physicians at both academic and community sites to present a case they've treated during a 1-hour weekly session via Microsoft Teams, with discussion led by a teaching faculty member. The vast majority of the sessions were led by Dr. Sushil Beriwal. Prior to each session, relevant articles were emailed to all physicians, physicists, and dosimetrists across the network. During the case presentations, various aspects of the case were discussed to determine how attendees would approach management of the case being presented, from workup and diagnosis to principles of radiation therapy and systemic therapy, as well as follow-up, with emphasis on clinically relevant literature and contouring principles. Sessions were made to be as interactive as possible, with the teaching faculty member leading the discussion seeking opinions from residents and attending physicians across the entire network. SA-CME questions were sent out following each session to assess comprehension, and a mid-year survey was sent out to assess quality of the sessions and determine whether there was a meaningful impact on practice patterns based on some of the newer data discussed. This is just an example of an SA-CME question that was sent out following our Hodgkin's lymphoma week. 30 attending physicians practicing across the integrated network responded to the survey. On a scale of 1 to 5, with 5 being the best score, the median overall rating of the quality of the sessions was 5, and the median rating of the post-session SA-CME questions was 5. When asked what the most helpful aspects of eRounds were, the number one answer was review of contouring for different disease sites, followed by discussion of potential management recommendations, learning about treatment planning and dose distribution, and learning about practice patterns across the network. There were several changes in practice patterns noted by physicians in the survey following the sessions. 20% of physicians reported new adoption of 5-fraction regimens for early-stage breast cancer. 40% reported changes in pelvic nodal contouring based on updated guidelines, and 40% reported new adoption of hippocampal-sparing whole-brain radiation therapy in appropriately selected candidates. Response to the sessions was overwhelmingly positive and helped assist radiation oncologists across the network incorporate newer data into practice, as noted following the first several months of sessions. Sessions allowed colleagues across the entire network to connect and learn from each other in a meaningful way.